on the computer and welcome everybody. We're going to be Scott's sharing a session tonight, and we're looking forward to that and looking to see if there are any new people who may want to unmute and share how they found out about the class and what they might hope to gain. Just kind of curious. You don't have to. Laura.
Hi, my friend Jamie told me about this a couple months ago, and I've been intending to get here. And I'm really pleased that they're recorded. There's a couple on osteoporosis that I want to go back to.
Welcome. Glad to have you.
Thank you.
Anybody else new to the class or?
Yeah, hi.
Okay,
Hi,
Ali.
Yes, I heard about you at the wellness fair.
Oh,
And so I had this Tuesday free and I was glad I could come and join you.
very happy to have you.
Thank you.
Welcome.
Thank you.
Well, I think I recognize most of the other people. How about you, Scott?
Yeah, I was looking through. The rest of them are pretty familiar names, looks like.
Anybody have any questions? Any thoughts about what's been going on in their life, how they're doing? Joan.
So I don't know if people know about the restaurant off of Crescent called Unrefined in Eugene, but it's really great whole food, plant-based. They have like Buddha bowls, they make their own drinks, they're all plant-based, and they make them right there, so it's all fresh.
Yes, it's the Unrefined Wellness Bar, and it's in the old Mezzaluna restaurant, if anybody remembers where that was.
I don't know where that is, but Crescent, where is Crescent?
It's close to your house. So if you just go down Gillum and then go like it's Green Acres turns into Crescent, it goes by your tennis club. And then you keep going east of Coburg Road, and then all those apartments and condos and stuff on the left. You come to the next stop sign there and take a left, and it's right in there.
What's it called again? I know exactly now. Thanks for that.
Refined.
Unrefined.
Oh, I'm sorry. Unrefined. Yeah.
Unrefined.
Unrefined.
Okay. All right. We'll have to check it out.
I have another comment.
Go ahead.
So there was, Dr. Greger had a video about Prevagen. So I asked my husband, and he did buy some, and I said, stop taking it. But then I was reading the label, and I didn't know that you had to so carefully read the label on things like this. But this contains milk, sugar, salt, and I wasn't expecting those ingredients.
In Prevagen?
In Prevagen.
Yeah. His video was really good. It would make you not want to take it.
Exactly. And it's also, they have this little red medallion up here. I guess it's to make you feel like it's really something special. And it doesn't say it's clinically proven. It says it was clinically tested.
Very clever indeed.
Yeah.
Good points you're making.
Thanks.
Thank you.
All right, I guess I can get started. I want to show a couple of things on the website. And my volume is okay for everybody? Can you hear me okay?
Yep.
Okay. All right. Well, since we have the Thanksgiving holiday coming up, I wanted to show you on the website. Here. So we go to the website and click on the recipes tab at the top. And I've had this here for a while. It's from Mary McDougall, John McDougall's wife, Holiday Meal Planning and Recipes. So you could use this for Thanksgiving and for Christmas, actually. So if you click on it, it's a document that it's a little, she did it back in 2014, but it's a bunch of holiday meal recipes and the whole planning and a shopping list and everything. So it's really good. So all festive holiday recipes: pumpkin soup, salad, stuffed pumpkin. You can read through all mashed potatoes. There's even desserts and stuff. And if you keep scrolling down through all these different recipes, what's kind of nice is she puts not only the shopping list, but she'll say what to do, what to start a week before, and then how that's the timeline of how to do it. So here's shopping tips. Here's the shopping list. And you scroll further down. And then right here, time schedule. 1 week ahead, do this. 3 days ahead, do this. 2 days ahead, do this. 1 day ahead, do this. And then, so yeah, it's just here on the website. So wanted to show you guys that, specific to the holidays. And then I'll be pulling this up again after my PowerPoint presentation on lifestyle medicine. We'll go to resources. We'll go to handouts from classes. And then right here, it's basically what is lifestyle medicine. You might want to check that one out because I'll be talking about that tonight. And then, so yeah, right here, lifestyle handout, nutrition to sleep. So the 6 pillars of lifestyle medicine, there's a 1-page summary of each of them. So when I'm done with the actual PowerPoint presentation where I go over the 6 pillars more broader view, I'll come back and I'll click on this and I'll show you a few more details about each of the 6 pillars on there. But you'll have access to these because you can just look at them on the website, and they're all in color, and you can print them out, share them with friends, family, whatever. And so much more detail on some of the stuff we're going to talk about with physical activity and stress reduction and social support and sleep health and all the other pillars. We'll come back to these here, but I just wanted to show you those now, so you could know that we'll be getting to that, and you have access to that stuff. So does anyone have any other questions, comments before I start the PowerPoint presentation? Or any questions about what I showed you there? All right, well, I guess I'll jump in here then. Oops, what happened there? Clicked on something. There we go. Let's see. Why am I seeing myself? I clicked on something and didn't mean to. Let's see. Not that, not that. Huh. I can't seem to get back to where I share my screen here. Okay, here we go. Share screen. You guys can see my screen again?
Yeah, I can see your screen just fine.
Now I just clicked on something and my big face was taking up the whole computer screen. So what that was about. All right. Okay. So I've given this lecture to PA students and actually also at a nurse practitioner conference up in Portland before, and so I've tweaked it a bit since then, but it's kind of a more general overview for providers and for anyone that's just new to lifestyle medicine and what it is. And so I hope you guys enjoy it. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. We're working on that. Hopefully Thomas Edison is prophetic and that will someday come true. All right, so I want to talk about, some of you guys might know some of this, or maybe you've attended this class before, but a lot of you haven't. So I kind of want to give you kind of an overview of what the traditional medical model is set up for, and before we talk about lifestyle medicine. So we have acute care with the traditional medical model. There's acute care and chronic care. So acute care examples are things like infections, trauma, get in an accident or get an infection, you need antibiotics, things like that. prescribing medications, doing surgery. So if you have a sudden heart attack or a stroke, you need acute care. You need a cardiologist to come in and do an angiogram and put a stent in and save your life from a heart attack. So that's what we call acute care. So something really sudden has happened, really life-threatening, or maybe not life-threatening, but you need intervention to actually treat it and curtail it. And so how do you feel like we're doing in that regard when it comes to acute care? How do you guys feel like we're doing there? Well, I can tell you from being in the medical field for 25 years, 26 years. If you go back to when I was a paramedic, it was all about acute care at that time. And as my 18 years as a PA, we're actually doing pretty well. Modern medicine has done a really good job when it comes to acute care. So we have good technology and surgeries and medications, and a lot of the science that's come out over the decades has really made progress here. So we're actually doing really well when it comes to acute care. But chronic care can be a different story. And examples of chronic care, it would be everything from heart disease, cardiovascular disease, heart and brain. So anywhere the blood vessels go, so your heart, your brain, your kidneys, pretty much everywhere in your body. That's what cardiovascular disease, and things like cancer, diabetes, again, chronic kidney disease, high blood pressure, cholesterol, things like constipation, heartburn, arthritis, all the other autoimmune diseases like rheumatoid arthritis and lupus and multiple sclerosis, inflammatory bowel disease like Crohn's and ulcerative colitis, and all the other types of arthritis, osteoarthritis. Pretty much about 80, those of you in the room that are medical providers, I don't know if we have any medical students here tonight, but pretty much 80 to 90% of what you're going to see in the office every day is going to be chronic care patients. And so how are we doing in that regard? Well, not so good, because more accurately, chronic disease management is what we're doing. And so the reason is because we don't have the right tools. So the tools that we use for acute care work really good for acute care, but we're trying to apply the same tools that we're using in acute care for chronic care, and we're not doing so well there. So when it comes to chronic diseases, medications just treat symptoms. They don't really actually treat the underlying cause. Surgery for chronic care hasn't really been shown to be very effective either. So, a lot of times we'll do studies where you do a placebo surgery versus an actual surgery, and it doesn't really show to really make much of a difference. And things like we've talked about in the cardiovascular disease class, where someone has just a little bit of chest pain, they fail their exercise treadmill test, but they're not actually having a heart attack, and we put stents and do bypasses on those patients. The studies show that doesn't actually extend their life. It doesn't reduce the risk of having an actual heart attack. And studies are starting to play that out and show that. And so it's because we're applying the tools for acute care to chronic care, and it doesn't seem to work so well. And because, why do you think that is? Well, because these are lifestyle related diseases that are caused by the foods we eat, how much we move, the stress in our life, how much we sleep, and the chemicals we choose, all the things we talk about in these classes. Those are the causative factors for these chronic diseases. So that's why we're not doing so well. But here's some good news. What if you could, and I always, again, show this to medical students and providers and stuff. So what if you could prevent 80% of heart disease, 80% of strokes, prevent 80% of type 2 diabetes, and prevent 40% of all cancers? That would be amazing, wouldn't it? Think if that came in a pill, how much value that would have. Well, we can do it. According to the Centers for Disease Control, the CDC, just eating a healthy diet, which is defined as not even 100% whole food plant-based diet, just a reasonable diet, just eating, a good, a proportion of your foods being whole plant foods, not even being super strict, and just getting adequate exercise and not smoking. Just those three things. eating a reasonably healthy diet, getting adequate exercise, and not smoking, you can prevent 80% of heart disease, 80% of strokes, 80% of diabetes, and 40% of all cancers. And of course, we know what we can do if we take it even a step further and really go all in on a full food plant-based diet and all the pillars of lifestyle medicine. So it's pretty eye-opening for people that are like myself, that came in and or maybe just medically trained, and we just learn how to manage these chronic diseases. Knowing that, if I would have known that back then, it would have been like, oh my gosh, well, how do we do this? You know, and we're not, but these things we don't really learn how to do in medical school or PA school. So what is lifestyle medicine? Well, this is from the American College of Lifestyle Medicine, and I just got back from the American College of Lifestyle Medicine annual conference. It was in Denver, Colorado. I was just there 2 weeks ago, and there's over 11,000 members now, and there's over 300 medical residencies in lifestyle medicine now that medical students and can go through, and it's really starting to spread. But the actual functional definition is the therapeutic use of evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. It empowers individuals with the knowledge and skills to make effective behavior changes that address the underlying causes of disease. So I know it's a long definition, but essentially what we're teaching in these classes all the time. So the 6 pillars, I know Charlie talks about these a lot and kind of groups some of them together, but according to the American College of Lifestyle Medicine, and I'm actually board certified in lifestyle medicine, they have a certification you can take and sit for a board exam, which I did back in 2019. And these are the 6 pillars: nutrition, physical activity, stress reduction, relationships and social connections, sleep, avoiding risky substances. And Dean Ornish puts it this other way. You might be familiar with Dean Ornish, who has his intensive lifestyle cardiac rehab class program that's covered by Medicare. He says, eat well, move more, stress less, love more. So that's kind of in a nutshell those 6 pillars into those 4. And so we'll go over each of these, but those are the 6 pillars. So I know we talk a lot about nutrition in this class, and so we don't have to go too in depth on this because you guys are already familiar, but there's sometimes those people that are watching this recording or here tonight that this might be the first time they've heard this. And so we are gonna go through this a bit, and I'm gonna show a video, a Dr. Greger video that you might have seen before, some of you, but it's a good overview of where the science is on nutrition. So with the science of nutrition right now, we have mostly what's considered a deficiency mindset, which is pretty much just that's kind of what I learned about nutrition in PA school, which was 1 8-hour class. And it was pretty much just talking about, what's a fat, what's a protein, what's a carbohydrate, what are some of the nutrient deficiencies like, scurvy, beriberi, kwashiorkor, pellagra, just things like that, and how to prevent nutrient deficiencies and the history of nutrient deficiencies. And then, so it's a real, or just focusing on, those macronutrients and micronutrients, mostly the macronutrients, the carbohydrate, the protein, and the fat, which is a real reductionist mindset when it comes to nutrition. And if you went back to if you want more detail on this section, between the differences between reductionism and holism being the whole food is what's important about nutrition, not the component parts that are important. It's actually the whole food that's important, the food choices that we make. And if you want to go more in depth on that particular topic, you can go back to earlier this year, back in January. There's a recorded class on nutritional myths and other popular diets that I did that you can go back and watch if you're interested in this whole deficiency mindset and where it came from and the holistic approach to nutrition. I would recommend you watch that. So what is a whole food plant-based lifestyle? Well, it's a diet centered around whole plant foods. Let's watch this video from Dr. Greger. It's an 8-minute cartoon. It's a really good summary of everything on nutrition and where he came from and everything. And I also have this video in the video section on the class website, so you can watch it there, or just watch the tonight's recording and see it as many times as you want, or share it with others.
It all started with my grandma. I was just a kid when the doctor sent my grandma home in a wheelchair to die. Diagnosed with end-stage heart disease, she'd already had so many bypass operations that the surgeons essentially ran out of plumbing. Confined to wheelchair, crushing chest pain, her doctors told her there was nothing more they could do. Her life was over at age 65. And then she heard about Nathan Pritikin, one of our early lifestyle medicine pioneers, and what happened next was documented in Pritikin's biography. He talks about Frances Greger, my grandma. It was a live-in program where everyone was placed on a plant-based diet and started on a graded exercise regimen. They wheeled her in, and she walked out. In a few weeks, she was walking 10 miles a day, went on to live another 31 years till age 96 to continue to enjoy her 6 grandchildren, including me. Her miraculous recovery not only inspired one of those grandkids to pursue a career in medicine, but granted her enough healthy years to see him graduate from medical school. So it's really all thanks to her. During medical training, I was shocked to find out that this whole body of evidence on reversing chronic disease with lifestyle changes, opening up arteries without drugs, without surgery, was being largely ignored by mainstream medicine. Wait a second, if effectively the cure to our #1 killer could get lost down some rabbit hole and ignored, what else might there be buried in the medical literature that could help my patients? I made it my life's mission to find out. That's what led me to start nutritionfacts.org, and that's what led me to write the book, How Not to Die. Studies show people wildly overestimate the power of pills and procedures to keep them healthy. For example, patients believe cholesterol-lowering statin drugs are about 20 times more effective than they actually are in preventing heart attacks. No wonder most people continue to rely on drugs to save them. But our leading killers aren't caused by drug deficiencies. The dirty little secret is that most people surveyed said they would not be willing to take many of these drugs if they knew how little benefit these products actually offered. Whereas cleaning up our diets is not only safer and cheaper, but can be more effective in preventing, arresting, and reversing some of our leading causes of death because you're treating the actual cause of the disease. Each year, the CDC compiles the 15 leading causes of death, and so I have a chapter on each: how not to die from heart disease, how not to die from lung disease, how not to die from brain diseases, digestive cancers, infections, diabetes, high blood pressure, liver diseases, blood cancers, kidney disease, breast cancer, suicidal depression, prostate cancer, Parkinson's disease, and how not to die from so-called iatrogenic causes, which is essentially death by doctor. That's the first half of the book, and the good news is that we have tremendous power over our health, destiny, and longevity. The vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors. I didn't want to just write a reference book, though. Yes, there's thousands of citations to peer-reviewed scientific papers, but I also wanted to be a practical guide on translating this mountain of evidence into day-to-day decisions. And so that's what became the second half of the book. First, I started out with a traffic light system to classify everything to red light, yellow light, and green light foods. Though there are exceptions, I talk about the best available balance of evidence suggests the healthiest diet is one that minimizes the intake of meat, eggs, dairy, and processed junk, and maximizes the intake of fruits, vegetables, beans, which are split peas, chickpeas, lentils, legumes in general, whole grains, nuts and seeds, mushrooms, herbs and spices, basically real food that grows out of the ground. These are our healthiest choices. Some foods, though, have particular medicinal qualities, and so I then center my recommendations around a daily dozen checklist of all the things I try to fit into my daily routine. So, for example, I recommend a quarter teaspoon of the spice turmeric a day, a tablespoon of ground flax seeds, berries every day, greens every day. I talk about the healthiest beverages, the healthiest sweeteners, how much exercise to get. The whole daily dozen list with recommended serving sizes is available as free apps for both Android and iPhone. Just search for Dr. Greger's Daily Dozen. There's only one diet that's ever been proven to reverse heart disease in the majority of patients, this plant-based diet. If that's all a plant-based diet could do, reverse the #1 killer of men and women, shouldn't that be the default diet until proven otherwise? And the fact that it can also be effective in treating, arresting, and reversing other leading killers like high blood pressure and type 2 diabetes would seem to make the case for plant-based eating simply overwhelming. Most deaths in the United States are preventable and related to nutrition. According to the most rigorous analysis of risk factors ever published, the Global Burden of Disease study funded by the Bill and Melinda Gates Foundation, the number one cause of death in the United States is our diet. The number one cause of disability is our diet, which is now bumped tobacco smoking to number two. Smoking now only kills about 500,000 Americans every year, whereas our diet kills hundreds of thousands more. So obviously, nutrition is the number one thing taught in medical school, right? The number one thing your doctor talks to you about at every visit, right? How could there be such a disconnect between the science and the practice of medicine? Doctors have a severe nutrition deficiency in education. Most doctors just never taught about the impact healthy nutrition can have in the course of illness, and so they graduate without this powerful tool in their medical toolbox. There are also institutional barriers such as time constraints and lack of reimbursement. In general, doctors aren't paid for counseling people on how to take better care of themselves. Of course, the drug companies also play a role in influencing medical education and practice. Ask your doctor when's the last time they were taken out to dinner by Big Broccoli. Probably been a while. It's like smoking in the 50s. We already had decades of science linking smoking with lung cancer, but it was largely ignored because smoking was normal. Most doctors smoked. The average per capita cigarette consumption was 4,000 cigarettes a year, meaning the average American smoked a half pack a day. The American Medical Association was reassuring everyone that smoking in moderation was just fine. There's the same disconnect between the science and public policy. It took more than 25 years and 7,000 studies before the first Surgeon General report against smoking came out in the 60s. You think maybe after the first 6,000 studies, it could have given people a little heads up or something? Powerful industry. And today's meat, sugar, dairy, salt, egg, and processed food industries are using the same tobacco industry tactics to try to twist the science and confuse the public until the system changes. We have to take personal responsibility for our own health, for our family's health. We can't wait until society catches up to the science again, because it's a matter of life and death.
All right, any questions about the video? Or about nutrition before I move on to the second pillar? All right. So physical activity, we don't call it exercise anymore. We actually call it physical activity because connotations to exercise might be, I got to go sweat at the gym, or I got to, lift weights. I got to, do something formal. And physical activity doesn't have to be formal. It could be, puttering around in your garden, in your shop, just doing something that's active, but you're on your feet, you're just not sitting. And that can be considered physical activity. There's different levels of it. There's kind of mild and moderate and more extreme physical activity, which changes how much you have to do to get the health benefits. And we'll go over some of the details when we go over the handouts. But so the consensus on the science is for health, to help give you the best health and prevent chronic disease, is to get 150 minutes per week of moderate intensity. And we'll go over kind of on the handout, we'll go over some of the examples of what those are. And where they came up with the 150 minutes is there's actually a curve. And so when they look at the studies and the science is like, so from when you go up from 0 and going all the way up to 150, there's a really steep slope curve of improved health benefits. So decreased mortality, decreased cardiovascular mortality, improvement in health, all the way up to 150 minutes. And then once you get to 150 minutes, the curve, it still goes up if you do more, but really flattens out. So you get the most bang for your buck getting up to that 150 minutes per week. And 60 minutes a day for children and adolescents. You probably remember I think it was Michelle Obama had the Play 60 for the kids, and that's where that came from. And so, but 150 minutes a week, that's really only 30 minutes a day, 5 days a week, and that's where you get the biggest bang for your buck. But yeah, if you want to do more than that, that's even better. But the the improvement in health curve starts to slope off, a little bit less severe. So at least shoot for that 150 minutes a day. And we'll go over some of the examples. Add resistance exercise, that's important. So doing like exercise bands, even some light weights, things like that is really important. As you probably remember from our osteoporosis class, it's really important for bone health to work those muscles and put the stress on the bones. And so that's also very important for strength. Even another example of a resistance exercise, if you're not even ready to do exercise bands or light weights, is just to like sit down in a chair without any arms on it, and just be able to sit down in a chair and stand back up, down and up, or even if you're able to get down on the floor and get yourself back up and off the floor over and over and over, because that works on balance, and that's a resistance type of exercise because you're kind of squatting, and so those are really important things to be able to do. So those are some examples of some resistance exercise. And then working on flexibility. So whether that means just doing some stretching on the floor in your home, doing Tai Chi or yoga, whatever you like to do, that's working on flexibility, but it's also working on things like balance, and it also can be a form of resistance exercise and a lot of those things. But I think what's most important is to do whatever you enjoy that involves movement. So even if you're not, ready to go, for a long walk or go jogging or ride a bicycle, because what I talk to patients about a lot when we're working on physical activity is you want to do something that you enjoy, but at the same time, depending on your activity level, your medical problems and things, you want to make sure it's something that you're less likely to get injured at. So like I'm a perfect example of that. I do a lot of bicycle riding, as you guys know, and I've broken a lot of bones and I've fallen down, and so then I broke my leg here a couple years ago, and I couldn't ride my bike for several months because I was in rehab. And so it's kind of like taking a risk at that activity where if I just stick to walking and stuff, I'm less likely to get injured. But I love riding the bicycle so much, I'm not going to stop. But I make that choice for myself. But so that's kind of comes into play. If you really do like doing something that's a little more risky, then you have to take that into consideration. But do whatever you like to do, that's something that you enjoy doing, that it does involve movement. And another example I have with many patients that I counsel is that somebody, when we're talking about the 6 pillars of lifestyle medicine and nutrition component and all that, and then they usually will ask me, whether it's a male or female, they'll ask me, well, what more can I do from an exercise standpoint? And then they say, well, I always know what people's jobs are, and I have a lot of patients where their job involves standing all day, moving around all day, more of a factory type of worker or mechanic or anything that they're constantly moving around. It's like, well, they're already getting their 150 minutes by far a week, and they're not sedentary at all. And so trying to tell somebody to go sweat at the gym after work after they've been on their feet all day is not reasonable. And if they want to do it, great. But I try to say to some of those people that you got the physical activity part covered, but if there's something more you want to do that you enjoy doing, then go for it. But that's just an example that maybe we should focus on some of the other pillars more for that particular person, just as an example. So the reason I wanted to go over all that is just to kind of make you think outside the box a little bit when it comes to physical activity. It doesn't have to be going to a gym or doing silver sneakers and doing all that. I mean, if you like doing that, that's great, because you're also integrating some of the other pillars in lifestyle medicine, like social support. If you go for a walk with a friend and you're talking with them, and now you're exercising or doing your physical activity with somebody else, and now you have a engaging conversation, the two of you are more likely to do that activity together because it's a connection, and you are accountable to each other. Or if you go to a gym or something, even if you don't do a whole lot of exercise there, you're engaging with other people, you're having conversations. So you're actually integrating one of the other pillars of lifestyle medicine right there, and that will also help reduce stress, and maybe you'll sleep better. And so a lot of these things kind of correlate together. And so any questions about physical activity? I know it's kind of a little bit more intuitive of the 6 pillars for most people, but I wanted to go over some of those differences and things to think about. And again, we'll go over some of the more examples of what's moderate intensity activity and that, because at the more high intensity, you can cut it in half to 75 minutes a week to get the same benefit, but we'll go over that. So stress reduction. So things like meditation, and this is another one that's a lot of people will think about meditation as like what this kid is doing here in the picture, but it doesn't have to be something formal like that. It can just be, it could be out for a walk. Like if you're walking around a track, for example, you aren't having to pay super close attention to your surroundings or traffic or things like that. And so you can kind of do active meditation where you're just inside your head, focusing on your breathing and walking, or even if you're just sitting and having quiet time and you're just doing your soft belly breathing where you're just breathing in through your nose and out through your mouth and taking slow, deep breaths, and you're really focusing on that. That's definitely a form of meditation. Or you could do things like the Headspace app or the Calm app that you can get on your phone, and they take you through more formal types of breathing exercises and meditation. So so those are ways to reduce stress, definitely. And other things like mindfulness. A lot of you might know what mindfulness is. You can apply this to any part of your life where you're just basically thinking about being mindful of what you're living in the moment. And so when you're eating your meal, you might be thinking about where this food came from and who picked it and collected it and how did it get to your plate, and kind of thinking about all those things, living in the moment and savoring each bite and chewing slowly. And that's a form of mindfulness eating. And then if you're feeling stressed and you kind of start to write in a journal because you're feeling stressed, that's a form of mindfulness, because you're okay, how am I feeling right now? What was my day like? And you start to write that down, and that's a form of mindfulness as well. And that's very helpful to reduce stress. And then you're also, how you interpret stress is really important. And we have Charlie said we've had classes on stress reduction and a lot of the mind, how our mind affects our health and things like that. Charlie's done classes on that, and so you can go back and watch those. But we also, on the videos section of the class website, there's a really good video by Kelly McGonigal, who's a health psychologist at Stanford University, and she has a really good video about stress reduction and how we interpret stress. And so because a lot of stress can be good, and there's a lot of positive stress too, and that builds emotional resilience, which I have listed there. And so we build up emotional resilience to certain amounts of stress. And if we interpret stress as being a positive thing, it's getting our body, our hearts going, and we feel like we're really amped up, that can actually be good, because that's increasing blood flow to your brain, and you're perfusing your muscles and your body, and you're more ready for action, to think on your feet and basically take on challenges. And so it's kind of how we interpret the stress makes a big difference in whether stress is a positive experience or a negative experience. And because we all have different levels of emotional resilience, and we can all tolerate different levels of stress in our lives, and we all have much different challenges in our lives, each of us do. So stress is definitely something we need to pay lots of attention to, and it has a lot to do with with the other pillars, and how much support we have, and how much exercise we get, and how much sleep we get. All those things contribute to stress. So you see how these kind of relate to each other a lot. So any questions about stress reduction? We'll have lots of time for questions at the end too. So relationships and social connections. So you can't state it enough, having loving and supportive relationships with friends, family, and significant others is super important, because whether you can even apply these 6 pillars depends on the support and the environment you have around you and the support you have around you. So and how these all relate together. We need to have that reinforcement. We need to have that support to be able to have a why in our lives, and to have purpose in our lives, and meaning, and all these things. And Dean Ornish talks about this a lot in his program for his intensive cardiac rehab, reversing heart disease. So important. That's why he does small group sessions, and people get in small groups, and they support each other, and they talk to each other about how they're feeling and things like that. And that was one of the things he talked about. It. He was actually at the conference in Denver, and he talked a lot about this, how, it was, it kind of goes into his love more section. And so a lot of these people were like, I couldn't see myself ever being in a group setting and talking about loving more. What's this all about? This seems pretty out there for a lot of people. But once they get in the group setting and they feel the support, and they feel that, and they realize that they're not alone in these with these feelings and these conditions, and how they're feeling about the condition. That's probably, I think Dean Ornish thinks that that's probably one of the most important things about his program is this component, because it's like, who cares if you're telling me to not eat this and eat that and all this, but if those things don't bring meaning, if I don't have meaning in my life, then none of it matters, right? And so it's kind of like, if you're smoking and those cigarettes were what were allowing you to cope, or getting that fast food was what was allowing you to cope, you're taking away what I used to cope for my stress and the unhappiness in my life. Now what? Now you're taking that away from me. Well, finding that peace and happiness and love within and with the people around you is what's going to give you meaning and hope, and what make you want to then make some of those changes, because you have something to live for. You actually have that reinforcement, and you have that why we talk about in these classes a lot. You got to have your why, so that you know why you're doing this and making these different diet and lifestyle choices. Is you want to always be reminded of your why and what gives you purpose and meaning in life. And then I just want to touch on the underlying needs. So when you're thinking about making a lifestyle change, we're always talking about, and I talk about with my patients, when they're ready to make a change, we have ways of deciding if they're ready, but their confidence to make changes, and whether they're pre-contemplation or contemplation stage, where they are in their stages of change. These underlying needs have to be met for it to be sustainable. And so we talked about having purpose, but you also have to have health benefit, of course. So that's one of the underlying needs, to have it be a positive health impact. It needs to be easy to do, and it needs to provide pleasure. We need to be accepted by others around us, and we need to also have autonomy. And autonomy means you need to do it yourself. You need to be the captain of your own ship, and realize that we don't want to blame anybody else. We can't blame our loved ones. We can't blame necessarily our environment. We have to be able to, at some point, be able to, for it to be sustainable, take charge and say, okay, just because somebody brought me this food, they want me to eat it, doesn't mean I'm still making the choice. I have to be ultimately responsible for myself, but you still need to have these other things kind of in place. So, environment does matter as far as it being sustainable, because if your loved ones aren't supportive, at least they need to be supportive of what changes you want to make. So it's still important, but still that autonomy has to be in there, because if Charlie or I just keep telling you to make these changes and just do this, that's one thing. That's not going to really be enough. You have to be the one that actually walks the path. We show you the path and show you the door, but you have to be the one that walks it. So any questions about relationships and social connections, that pillar? And again, I'll have a one-page handout of all of these, but have good resources and stuff on it. It also has examples of what we call SMART goals, basically an example of what kind of a change, a really small step change you can make in each of these 6 pillars. Let's talk about sleep. So this is a huge, there's tons of science on this. And this was a big section on the board exam when I took it, all the science regarding sleep and how important it is. So it's not just quantity, it's also quality of sleep. And again, I'll have a good handout on this we'll go over, but so quantity it's kind of, the science rests on somewhere between 7 and 8 hours for an adult. Teenagers and kids need a little bit more like 9 or 10. But 7 to 8 hours is generally recommended. So anything less than 6 is bad, and anything more than 9 hours a night is bad. And so there's something to be said about how much you actually sleep versus your sleep. Sleep opportunity is a term they use a lot. So if the light's off, you're laying down, you're you're have an opportunity to sleep, you want that to be somewhere between 7 and 8 hours is kind of the ideal. And then the quality of sleep is important too, because you could end up waking up multiple times a night, tossing and turning, or you could have something like sleep apnea and you're waking up a lot because you're stopping breathing. So all those things go into the quality of sleep, because you go through these sleep cycles multiple times throughout the night, and we have to get a certain amount of each of the cycles to actually get good restful sleep. And so the handout will go over the different sleeping tips and sleep disruptors. So in general, you want a cool, dark room with good airflow, lack of light, so no blue light, what we call. So like your cell phone, your TV, or other electronic devices provide the blue light, and the blue light actually stimulates cortisol, which makes you more awake, and suppresses the melatonin, and melatonin is what makes you sleep. And so there's a ton of science on that, but I also wanted to mention, for sure, sleep apnea, because it's so prolific, and you'll never get a good night's sleep if you have underlying sleep apnea. So if you have a hard time staying awake during the day, your spouse or partner says that you're snoring a lot, or you're gasping for air at night, and they hear you stop breathing, you definitely want to go see your medical provider and make sure you're screened for obstructive sleep apnea, because it's very common, and you might need to have CPAP, and it makes such a huge difference. I have so many patients that had borderline diabetes, high blood pressure. They were just fatigued all the time. They just were terrible. Couldn't lose weight. They're gaining weight. And then they were diagnosed with sleep apnea. I sent them for sleep study, and they have sleep apnea. And once they got on the CPAP, blood pressure dropped, weight started dropping. They felt so much better. And so it makes a huge difference. So it shows you how important sleep is, because those stress hormones are being released all the time. The cortisol is just being constantly secreted in your body, in your natural steroids in your body, when you're chronically hypoxic, or chronically not getting enough oxygen and not getting enough sleep. And so those stress hormones, it's almost impossible to lose weight and be healthy when your body's having that chronic inflammation, chronic stress that causes. So sleep is so very important. Questions about that? Okay.
Trouty?
Yeah, I have a problem with sleep, but when I turn the light on, then I can sleep better. Why is that?
And maybe it's just something you've adapted to. I don't know. You might have to try to break the cycle, but as long as if the light's on and you're sleeping well, I guess it's okay. But if you feel like you're not getting a very good night's sleep, you want to try to break that cycle, because the light that's going, even though your eyes are closed, the light stimulates through your eye, even your closed eye, and it's going to make it hard for the cortisol levels to go down and the melatonin levels to go up. So it's something you might want to try to break the cycle of, but you might just be habituated to doing that.
Well, also, the less sleep I get, often the way I feel better. But is it because of age that we need less sleep? I can hardly ever get 6 hours, 5 at the most. And if in the morning I sleep more, and at night I come awake. But maybe that's got something to do because I was living in Europe.
Yeah. Well, I know the studies show that as we age, we tend to not sleep as well. So that's documented, but I don't know that we have any science that shows that we actually need less sleep as we age. I think the science still rests on that 7 to 8 hours there. So, but it could still be that sleeping opportunity. So if you're only sleeping for 5 to 6 hours, but you're laying down in bed in a dark room for 7 to 8 hours, you might still be okay, because you're giving yourself that sleep opportunity, as long as you're not feel like you're waking up too much or restless, and you still feel rested during the day. That's a good sign. So
Okay, should I take something in order to sleep better? How does it help my brain? I'm worried if I take a pill for to sleep, then it may affect my mind, that it would not be good for it.
that's correct. So that's a great question. So studies show that anytime you have to take anything to help you sleep, so whether that's melatonin or antihistamine like Benadryl or it's Ambien or any of these sleep aids, they actually show it's going to poorly affect your sleep quality. So you might get adequate quantity of sleep, but studies show it negatively impacts your sleep quality. And so it's not good. I mean, those medicines are designed for very short periods of time. Even melatonin that you take over the counter, that's okay to use to temporarily if you have jet lag, or if you had a death in your family and you're just really having a hard time, then taking some of these sleep aids for a week or two is okay, because it's so important to get sleep, whatever sleep you can get because of the trauma you're going through. But studies show if you take those for extended periods of time, they negatively impact the quality of your sleep, even if your quantity of sleep is okay. So I always try to counsel patients that you don't ever want to depend on anything to help you go to sleep at night when it comes to medication, even over-the-counter medication.
Thank you for letting me know, because I thought I had to take the melatonin, but sometimes I don't. And I have very short sleep, but I sleep like dead. I can't hear and nothing. And so my sleep is good, but it's very short.
Any other questions about sleep?
Okay, Dottie?
Yeah, I had a question about how prevalent sleep apnea is and whether it's on the rise. It seems to me like our unhealthy eating is probably making it go up, but how prevalent is it just generally? I'm curious.
Very, very prevalent. Yeah, I'd say, I don't know the exact percent number, but it is going up significantly. It has a lot to do with anatomy. So if you're overweight and gaining weight, you have more, basically your tongue gains weight too. So when you gain weight, your tongue gains weight, your palate starts to get floppier, and then you have more weight around your neck is another risk factor. But there are people that are thin that get sleep apnea too, so it's not ubiquitous. But I have had a lot of patients, counseling in lifestyle medicine, where once they lost weight, their sleep apnea went away and they didn't need their CPAP anymore. So it can be reversed many times. But again, I have patients that are thin and don't need to lose weight, and they still have sleep apnea. So it's definitely not a panacea there. But yeah, it's very prevalent. So it's so much so that anyone that I have, I mean, I always ask people, that's what's so great about lifestyle medicine. When I see almost every patient, I'll say, well, how are you sleeping? And because that's going to be so important to their health. And when you just ask a few questions, and there's a screening tool we call the Epworth sleeping score. And so there's a little questionnaire I can run through with a patient, and it gives me a number and it tells me what their likelihood of sleep apnea is. And if it's pretty high, then I have a low threshold to send patients to the sleep lab and have them evaluated. So yeah, very prevalent. So it's definitely something to be on everybody's radar.
So I looked on a Google search. It said approximately 39 million U.S. adults have sleep apnea, and that worldwide 936 million adults around the world have mild to severe sleep apnea. That's a lot of people.
Not a lot. It's definitely a high percentage of my patients, because I have a lot of elderly that are really poor health. So it's not, I probably don't go one day without having a patient that has that on their problem list, obstructive sleep apnea. So it's I see it every day myself.
Hey Scott, do you mind if I make a comment?
Sure, go ahead, Kristen.
I don't know if you can hear me okay.
Kind of breaking up a bit.
But one of the reasons, oh, okay, hang on, let me see.
Yeah, so it's hard to hear where you're at right now. You want to try that once again, or?
You know what, why don't you continue? I'll see if I can figure out what's wrong on my end.
Okay, sounds good. I'll jump to chemicals we choose, and then yeah, we can jump in anytime. So the things that are obvious about chemicals we choose would be tobacco, so smoking tobacco or chewing tobacco, alcohol, caffeine. But the one, and Charlie's talked about this too, the prescriptions, the pills we take, those are poisons too. So, you know, sometimes they're necessary, but they are the third leading cause of death in this country. It's just kind of the dirty little secret. Even taking medications as prescribed, we're not talking about overdoses, accidental or anything like that. Just taking medications as prescribed, that's the third leading cause of deaths. Like something like 140 or 150,000 Americans die every year just from side effects of their prescription medications taken as prescribed. So, you know, they do help. Like blood pressure medicine, for example, prevents a lot of heart attacks and strokes. So you take the good with the bad, but it's still considered a chemical. And I remember from my first day of PA school, our pharmacology class, we had a pharmacist that came and he said, "Hey, these are poisons you're going to be prescribing to your patients. They are actually poisons, and I want you to have a respect for them. But they have benefits, but they have side effects and risks. And so you want to treat them with a lot of respect and don't take them unless you really have to." And so that really, that was way back. That was 20 years ago, and I still remember that lecture to this day. And then, yeah, too much caffeine, alcohol, all that stuff. So this is really important, is that we limit these things and decrease them or avoid them if we can. Questions about that? I know it's kind of a lot of the science, the board questions I took on this, and there's some. I'll go over the handout, but a lot of it's kind of, again, for most providers, it's pretty standard. Actually, this is probably the pillar that we get the most training on in PA school and medical school, because we're taught how to screen for alcoholism and try to get patients to quit smoking, and because we know those things are bad, and so we try to get patients to avoid them, and that's something that we get good training on. And so but the nutrition aspect, not so much, right? But this one's kind of more intuitive in that way.
I have a question.
Sure.
I was wondering if you are on a whole food plant-based diet for quite a while, would you be able to get off the levothyroxine for my thyroid?
Yeah, so sometimes, it depends on the cause of it. If it ends up that the cause of the low thyroid was, say, an iodine deficiency, you weren't getting enough iodine. And so then if you took an iodine supplement or ate sea vegetables and got your adequate iodine, there's a chance that your thyroid function would recover and you wouldn't need the medication anymore. If you had, Hashimoto's thyroid hypothyroidism, for example, where your immune system completely destroyed your thyroid, most of the time you would never be able to get off your thyroid medication because you just don't make any thyroid hormone anymore because the thyroid gland has been destroyed. But there are what we call published case control studies. And so there's no good like randomized controlled trials or observational studies or interventional studies or anything that show people can get off their thyroid medication when they change to a whole food plant-based diet. But we do have published case control studies. And what those are basically patients where they did a write-up and it got published in a peer-reviewed journal. And it said, okay, yeah, this patient had what we thought was Hashimoto's hypothyroidism. So their immune system was attacking their thyroid gland and suppressed it, and they had to be on thyroid medication. And then sometimes they'd been on the thyroid medication for years, and then they went on a whole food plant-based diet and exercise and stress reduction. So they really kind of went all in on the 6 pillars of lifestyle medicine, and all of a sudden their thyroid function recovered, and we could take them off the thyroid medication. So there are cases of patients that have been able to get off of their thyroid medication, but we don't have good data to say what's the chances of that, because it's just the case control studies. But I've been teaching lifestyle medicine for 11 years now, and I've had dozens and dozens and dozens of patients that got off their blood pressure medicines and their diabetes medications, their insulin, got off their statins, got off all their other medications because I had to, because their blood pressure was too low and because they dropped it with the diet and lifestyle, and their blood sugars got too low. I had to take them off their insulin. And so we can get off some of these chemicals, these prescription drugs, if we have a healthy enough diet and lifestyle. So great question.
So I guess what I'm saying is I was diagnosed with a low thyroid when I was, I think, 60 years old. And the doctor just said that sometimes when you get older, you just don't produce as much. Does that sound reasonable, or is that my diet?
Hard to say. You would have to do to know if you're because the most common reason that someone would lose their thyroid function is this Hashimoto's, and so it's your immune system attacks your thyroid gland, and so you have to be on the medication. So the only way to find out is to keep taking the medication, go on a whole food plant-based diet completely, do the best you can, and work on the other 6 lifestyle factors, and then your thyroid function will continue to be monitored. We usually monitor it annually, once a year.
Yes.
We'll check it more frequently if somebody's so symptoms that you're maybe too high on your thyroid would be all of a sudden you're kind of feeling like your heart's fluttering, you feel really amped up, you feel really like you're on speed, for example. And then you check your thyroid and it shows that your thyroid is too high. And so then, we need to lower your dose. And so the only way to know is to continue to monitor the blood tests, continue taking the medication, and then your blood tests and your symptoms will determine whether we can actually remove the medication or not. So there's no way to know the answer to your question. You just have to give it a try and see what happens. But you want to keep taking the medication because it's not good for your health to have low thyroid and not take your medication. So you definitely want to.
I was put on 75, I think it's MCGs, I can't remember exactly. And I was on that for 5 or 6, 7, 8 years. Then I went up to 100. And then when I started on the plant-based diet, I'm down to 88.
Yeah, just keep it up and see what happens.
Okay, great. Thank you.
You're welcome. Right. So which of the 6 pillars do you think has the biggest impact? And kind of a complicated question, but when I taught this class live in person, I get a show of hands and whatnot. So what do you think has the biggest impact on health? Is it the nutrition? Is it the physical activity, the stress reduction, the relationships, social connections, the sleep, the chemicals? It's kind of everyone can have their opinion on that. I can just kind of talk about what in my experience with my personal experience. You guys know my story. I had all five of those 6 pillars down pat, and I still had pre-diabetes, and I was overweight, and I had high cholesterol and irritable bowel and heartburn and good little gut on me, and I had 5 of those 6 right, but I didn't have the food right. I didn't have the nutrition right. And once I fixed that, then I got my health back. And I've had a lot of patients that way too. But in essence, they're all very important, and they're all interrelated. And we'll have a lecture coming up in next year and next few months where we can kind of spend a little more time talking about tying all these together and how spend a little more time on how important all these are and how they relate to each other, how they work off of each other. So you can have your opinion on that. We can discuss it, but you probably kind of know the answer is they're all important.
Yes.
And then I have a little slide here on the blue zones. You guys are probably pretty familiar. The Netflix documentary that's out right now, and also in our book club, the class book club led by Lisa Chick. We're reading a book on the blue zones right now. And so those are the 5 blue zones. And the reason I have this slide in there is because they kind of have all 6 of those things nailed down right now. Well, in the past, they're starting to westernize their diet and lifestyle. So the blue zones are starting to fade away, unfortunately. But kind of the key is, once you read the Blue Zones book or watch the documentary on Netflix, the whole book, the whole philosophy of the Blue Zones, the way they live their life is in essence these 6 pillars right here. So there's the 5 blue zones. And I just wanted to give you a couple of quick cases here, because the medical students and the providers really like to see data. They like to see examples of patients I've had. And so here's one, a 55-year-old male, has type 2 diabetes, high blood pressure, obesity, and a cardiomyopathy, which means his heart is diseased and enlarged. And his medications are glipizide, which is a blood sugar lowering medication, metformin, which is also a diabetes medication, lisinopril, which is for blood pressure and kidney protection. He takes a daily aspirin. He's on carvedilol, which is a beta blocker, pretty much for his cardiomyopathy. And he's on Toujeo insulin. which is a really high dose insulin. It's 300 units per milliliter, which is basically 3 times the amount of regular insulin. So he's on 12 units, which is like essentially like taking 36 units of regular insulin, because it's usually 100 units per milliliter, and this is a 300 units per milliliter. So he's essentially on 36 units of insulin and all these medications. Blood pressure was good, well controlled on the carvedilol and the lisinopril. His weight's 226 pounds, which puts his body mass index at 30.7. And despite all of those medications and all that insulin, he obviously needed to go on a much higher dose of insulin because his A1C was still 13.8%. So that's a blood sugar well over 300, closer to 350 average. And he's on all those medications. So that's where he was at when he came to see me. 6 months later, after applying a whole food plant-based diet and the other healthy lifestyle pillars, he was completely off his 2JO insulin, off his glipizide, off his metformin. His lisinopril dose, I reduced it from 40 milligrams to 10 milligrams because his blood pressure was too low. I wanted to try to get him off the carvedilol and the aspirin because first he had the cardiomyopathy, but his cardiologist insisted he stay on it, even though his blood pressure was kind of getting a little bit too low. But that's why I was able to lower the lisinopril. Blood pressure is still 122/82 on less medication. So that's a little bit better blood pressure actually. And he lost 20 pounds. So his BMI was down to 28 and his A1C dropped to 7.4. So on no insulin, no glipizide, no metformin, so no more diabetes medication. And his A1C, went from 13.8 down to 7.4. So 6.4% point drop in just 6 months. So I wanted to show you the power this can have. Another case, 50-year-old female, actually a patient I never even saw myself. It was actually one of my colleagues, one of the physicians down the hall from me. She gave her the class flyer, and she actually never even came to any of our live classes. She just watched the recordings. So she just utilized the website and the recordings, and this got all this information secondhand through the physician that takes care of this patient. And she said that in 6 months, her A1C dropped from 13.7 to 5%, and now actually is weaned off all diabetes medications. She was in the process of weaning when I made this presentation. Blood pressure is normal, and she was taking her off the blood pressure medications. She got a 100-point drop in her cholesterol. Now she's off her statin, 40-pound weight loss, and feels great. So, and this physician who's been a family physician for like 30 years, she said she'd never seen this ever in her career, and so she was just dumbfounded that this could happen. And so fortunately, she sends a lot of patients to these classes. So I just wanted to give you that case as well. So any questions, I'll stop sharing. This is, I have some websites here, American College of Lifestyle Medicine's website, of course, my email, and then of course the class website, which you guys know is, I show this slide to people that aren't familiar with these classes or what we do. And
how do you know what your A1C should be?
So the A1C, if you're normal, is 5.6% or less. So that would be considered normal. 5.7% up to 6.4% is pre-diabetes. And then 6.5% and up is diabetes. And so it's a percent number that gives an average blood sugar over a 3-month span of time.
So 5.6
and below is
or less would be normal. Okay.
Yeah. Still got to figure out. I'm only seeing my gallery. Oh, there we go. I think I've got it.
I have a question.
Yeah, go ahead.
0.2 TSH, what does that mean?
TSH normal is about 2.0 or so. There's a reference range for what's normal on.
So what's the 0.02? What is it, too high, too low, or what?
So that's too low, which means your thyroid is too high. It's a reverse relationship. So
too
high. TSH is low, that means your thyroid is too high. When your TSH is high, it means your thyroid is too low.
It's crazy. Okay, yeah. All right. Thank you.
Questions before I'll show you guys the handouts. All right, let me go back to sharing then. I'll go over those, show you guys the handouts. Here. There we go. You guys can see those okay? You guys can see these okay? Hello?
Yes. Yeah.
Yeah.
Somebody speak up, please. Okay, I want to make sure. Here, I mean, trying to get it to expand.
Yeah.
Okay, so there's the nutrition. So, you know, you guys probably it's pretty self-explanatory there. Probably need to show too much there.
Yeah. Ken?
Yeah, Scott, you mentioned Zestrol? Did you mention Zestrol?
Lisinopril, that's Zestrol is one of the brand names of.
Yeah, Lisinopril.
Yeah.
Did you say it was good for your kidneys? I might have misheard that.
Yeah, so even if somebody with type 2 diabetes or even type 1 diabetes for that matter, if even if they have normal blood pressure, the standard of care for diabetes is to put somebody on that category of medication, whether it's lisinopril, which is an ACE inhibitor, or an ARB, which is angiotensin receptor blocker. There's two classes of medications that we tend to put patients with diabetes on because it helps protect the kidneys. So you see how we, once a year, we usually check to see if there's any protein being spilled in the urine for somebody with diabetes. And so the studies show that category of medication, like lisinopril, helps to protect the kidneys from spilling the protein. And so even without high blood pressure, we tend to put patients on that particular type of medication. So here's some examples of moderate activity: brisk walking, heavy cleaning, like washing windows, vacuuming, mopping, mowing the lawn, like even with a power motor, light bicycling, recreational badminton, doing doubles tennis. And then vigorous activity would be hiking, jogging, shoveling, carrying heavy loads, bicycling fast, playing a basketball game, soccer game, tennis if you're doing singles, because it's a little more vigorous. So what I was talking to you guys about, the 150 minutes is moderate activity here. You can cut it to 75 minutes if you're doing vigorous activity. And then here it does show a range, so 150 to 300 minutes of moderate intensity, so that you get your most bang for your buck up to 150, but you get even more benefit all the way up to 300 minutes, which would be an hour a day. Again, the slope starts to drop a little bit once you get over 150. And then 75 to 150 if you're doing vigorous activity. And then it goes over more activity types here, talks about the endurance, resistance activities. So we kind of went over that a little bit. But I wanted to show you guys the activity goals. So you hear those of us in behavior change talk about SMART goals. And that's kind of health coaches talk about that a lot too. So like any of you have seen Lisa Chick, she probably goes over these kind of things with you. So your goals for any kind of lifestyle change should be what we call specific, measurable, attainable, realistic, and time connected. So in each of these handouts, it goes over what's an example of activity. For physical activity, what would be a SMART goal? So what activity would you like to do? How much and how many sessions? Do you have what it takes to follow through? What can you actually do? So knowing your limits. And then time connected, how frequent and how long? So do you want to have it to be like, okay, so example would be, I'm going to walk 3 days a week for 30 minutes for the next 6 weeks or something. You kind of have a specific goal in mind, and those have been shown, those SMART goals have been shown to be more doable. And instead of just saying, oh, I just need to get more physical activity, not really have a plan that's specific, it makes it more hard to kind of find, do it. You don't really know it, you have a real specific goal in mind, it's kind of hard to make a plan and make a change. And then here's some sort of lifestyle stress reduction. There's actually also on the right-hand side, there's different resources you can check into, online resources for each of these pillars. So you can read through these. We kind of talked a little bit about it during the presentation. And then good stress and bad stress and all that. And there's the SMART goals again, and then social connections. And I say that, coming to these classes, you could say is a social connection. We're accountable to each other. We see each other every week. It's kind of a form of social connection, even though we're doing it virtually. Or other things like joining a volunteer organization, or going to the things we do with Eugene Plant-Based Providers, or maybe you want to volunteer somewhere. Anything you want to do where it's going to allow you to have social connection, that's going to be really important. So it gives examples of forming new social connections there. Again, gives you the SMART goal for that. We're going to go into the risky substances, which again, pretty explanatory. It actually talks about what the guidelines are. So if you think you might be drinking too much, what do the guidelines say? How much is too much? And it goes through it here, and there's all kinds of resources here. So if you have a substance use disorder, then there's good links to different websites where you can get help. So that's all here. And then sleep health, this is a really big one. I hand out this handout to almost every one of my patients that has any sleep issues. If they're on any kind of sleeping medication. I have a lot of patients that come see me. That's their main complaint when they come to see me, is they're having trouble sleeping. And I give everybody this handout because it goes over the sleep disruptors and tips for better sleep. And then, again, I'll screen them for sleep apnea and all that. So there's all kinds of information here as well. And that's the 6 pillars. So definitely, you can print these, you can download them, you can just look at them on the website anytime you want. So I want to leave the rest of the time for just discussion and questions.
I'll run. Unmute.
Scott, I have a question for you. The time limits or time suggestions that you had for activities were for ages up to 64. And when you are older than that, are you suggesting more or less?
I think that's just where the studies they only made a kind of an evidence-based recommendation to that age, because after 65, then there's a lot of other potentially health problems that could get in the way. So if somebody has heart failure or lots of arthritis or something, the types of exercise they can do might be limited somewhat. So I think then it becomes more more tailored to that individual person. You always hear about check with your doctor before you do an exercise program. I mean, that they've kind of lifted that for the most part, especially for people under 65. They've kind of all the lectures I've gone to and study I've done on the physical activity, they've kind of, that's not really, you don't really need to worry about that so much. But if you're over 65 and you're on tons of medications and have a lot of other health problems, it's not that you can't do physical activity. You may just have to be, kind of more mindful of what you do and how you do it. And so you don't fall down and get hurt. Like we talk about in the osteoporosis class, it's like, it's not a calcium deficiency disease. We can do a lot when it comes to diet and, taking vitamin D and getting sunshine and all that and getting exercise. But then the biggest risk factor for osteoporosis is actually falling down. You don't want to fall down whether you have osteoporosis or not. So especially if you're over 65. So that's where I think that would come in, is just being a little bit more thoughtful and mindful about what type of exercise you can reasonably do with your medical conditions and your body habitus and things like that.
So it's the precautions you take, but not, you can still do the same amount of time. And
you can still do the same. I would still shoot for that 150 minutes, even if you're 80. But it might be just a really easy walk, or maybe you want to do some swimming if you have lots of arthritis or something, even though that's not weight bearing, but it's movement. So any kind of movement you can do is going to be good.
Yeah, okay, sounds good. Thank you.
Ken, do you have your hand up still, or another question? Okay, hand went down. Anybody else? Scanning the room. Laura.
Yeah, I'm wondering if there's any guidelines about inactivity, like sitting. Like I've heard sitting's the new smoking. So what are guidelines for that?
Very, very, very true. So it is, yeah, great question, because I like to touch on how, here's another bit of information. So say you can't really do a 30-minute to 60-minute physical activity every day, but then you can move around, you can do housework, you can work in your garden, you can move around, but you can't really do a sustained, aerobic activity or something like that. That movement and not sitting, just the fact that you didn't sit for hours at a time, is better for your health than if you were somebody that worked out at the gym for 60 minutes, sweated your butt off for 60 minutes at the gym, and then sat for 9 hours, 10 hours at work. That person is worse off when it comes to cardiometabolic risk, overall health risk, than the person that just didn't sit all day. They were standing, they only sat for maybe 1 or 2 hours the entire day. They were on their feet the whole day. From a cardiometabolic risk factor, the person that's moving all day is better off than the person that sweat for 60 minutes every day, but then was sedentary. So yeah, very good question. Yeah, if you can do both, great, but just don't sit for a long time. So even if you're get up every 20, 30 minutes, move around, even if it's just for a few minutes, and then before you sit again, or you can get a standing desk if you're working, or even a treadmill desk. It's so important. So yeah, it's a great question.
Thank you.
All right.
Thank you. I have another question. I have a good friend who is like in his mid-80s, almost getting towards 90. But last week he went skiing. I was almost tempted to say, maybe you don't want to do it because he had some knee surgery a couple of months ago. So what do you think? Should I say, doctor told me not to do it for you?
As long as he understands the risk of, of getting hurt, falling down. But if that's something he enjoys doing, then, can't really fault him for doing it. Just like me, breaking my leg. But yeah, I mean, goes into the risk benefit ratio. If you're just doing it because it's just something you love doing, like Ken does a lot of mountain climbing, hiking, and he could fall down and get hurt, but he loves it. So I wouldn't tell him to stop doing it.
Yeah. Well, okay, sounds good. I love bicycling and hiking and all that, so I keep on doing it.
Yeah.
Okay. Yeah.
Nikki.
Well, that reminds me, I used to have a friend who was about in his late 80s, and he would go out off cross country skiing, and his daughter worried about it so much, but she thought he loved it so much. He didn't mind if that's how he was going to go. And just anecdotally, I want to share about people exercising. That I used to be very athletic and work out at the gym a lot and ski and hike and rollerblade and things. And as I age, I can't do all those things anymore. And I'm spending a lot of time at pools these days. I have some mobility issues. And what's very interesting there in the aqua jog lanes, you will find a lot of people who used to be very athletic, who for various reasons, arthritis or spinal stenosis or whatever, or all kinds of things, can't be doing what they used to, but they can still be in that aqua jog lane. And so it's just amazing to talk to the people where they're working out that way. And I think in the lap lanes too. But yeah, so that's kind of one of my last areas that I can still be very active in.
Any other thoughts, questions from anyone in the group? We have a few more minutes left.
Next week, we're going to talk about pandemics, how our food choices affect pandemics. Obviously a hotter topic. The last couple of years we've done that class, but still relevant.
But it'll be science-based.
Yeah. Dr. Greger has a lot of videos on it, and that's another video that's on the video section of the class website. Many of you probably don't know that Dr. Greger, before he got into nutrition, he was actually expert on infectious diseases and pandemics and zoonotic illnesses, animal-borne illnesses and stuff. So there's a lecture he gave. It was back. It's on the website. You can watch it. It was back before his Nutrition Facts days, and back then I remember, because he looks a little bit chubbier and a little bit less healthy than he does now. And I remember I saw an interview with him about that when he did that lecture, and he said he was kind of a junk food vegan when he did that lecture. So if you watch that lecture, you'll notice he's got a little bit of a belly on him. He doesn't look quite as healthy as he does now. So interesting, because many may or may not know, he was the expert witness. Do you remember when Oprah Winfrey got sued by the cattle industry years ago? Dr. Greger was her expert witness on the stand, actually. And because that was back when he was with the Humane Society and did a bunch of stuff with zoonotic illnesses and stuff. And
so Scott, you say that's we can get that on your website?
Yeah, it's on the class website under the videos section. So
oh, great. That sounds interesting.
Yeah. So that'd be a good one to watch before we do the class next week, if you guys are going to attend class next week.
Oh, okay. I have another comment. As the winter sets in, I find that fresh vegetables like salads and such are not in my garden anymore. So I was cleaning this morning the garden, taking out the tomato plants and all that. But lo and behold, I found some arugula growing in my garden, and I was so thrilled with that. But in case, do you have any other suggestions? Things like sprouts or, things of that nature that you can substitute for salads or dark green vegetables?
There's always lots of frozen vegetables available. And then Charlie can talk about sprouts. I know he does sprouts.
Yeah, so sprouts are really easy. Broccoli sprouts are good ones. They're easy to grow. Radish sprouts are really good and easy to grow. You can do mung beans, peas. I've done those 4 on a pretty regular basis all year round. We have kale that's grown in the yard, in a pot. It's pretty hardy even in winter. And like Scott said, frozen is a really good option. I don't know about farmers markets, whether they're still growing some. I imagine cabbage and other stuff grows in winter.
Sure. Thank you. Thank you.
I don't know if we have any farmers in the class who can share any comments about that. Anyone else in the class? Rob?
From going to the farmer's market, it seems like there's a couple of them that have commercial sized greenhouses, so they still have a partial array of greens and leafy vegetables and things like that. It's trending toward wintertime plants, but it's worth going to, especially since they have that new building. So it's undercover, part of it. Okay, Marilyn?
I still have collards, kale, and winter density lettuce that is out in my yard, and it will, because it's mature, it will last all winter. It won't grow anymore if you pick all the leaves, but it's mature, and in the spring it will sprout out again, the old ones, and try to go to seed.
Where's the farmer's market that we just heard about? Is that Eugene Farmers Market? Yes, down at 8th and Oak. 8th and Oak. Is that pretty close to where it used to be? Yes, they took down the parking structure and built a permanent building for many of the booths, yet there are still stalls and things out around that building. I
Thanks.
don't know if
Haven't
they're
been
still doing it on Tuesdays. Sometimes they do it on Tuesdays and Saturdays. You can call Eugene Saturday Market and they'll tell you.
Thanks.
Sure.
Marilyn?
I was just gonna go on what everybody else has said. The kales do really well, the lettuces do really well. We've had a pretty mild winter, so there's a lot of things that grow outside. Any of the kales get sweeter. Beet greens are really good. You know, I always plant peas in January or February to get an early crop because they're not a winter thing. But Oregon's really good, and it doesn't take much of a cover. I know my greenhouse, I just keep from freezing. I don't keep it heated much more than 35. And I was a professional gardener for 25, 30 years. I took care of a 50-acre estate. I mean, and that's how I kept it there too. And the guy that owned it was the millionaire. I just got to play.
Love hearing about people's lives and skills. It's like I have no growing gardening skills whatsoever. I might know a lot about food, but I don't know how to grow it at all.
You've got plenty more years left to learn.
Thinking that. And
Although we do.
A good gardener is just somebody that goes out in their garden and figures out what grows. If a plant is hard to grow, you need to grow something else.
Anyway, tonight has been great. Thank you, Scott. And are there any last question before we end off and spend another week in Oregon or wherever you're living?
Did Kristen ever get her microphone working?
I did.
Okay, Kristen.
Oh, okay. Sorry, I was I figured it wasn't even that important. All I was gonna do is comment on the sleep apnea question that somebody asked, whether it was increasing in frequency or diagnosis. And I think the answer is twofold. One is that it is more common, like Scott was commenting on, but I think the other part of it is that we're recognizing it, that it's a problem. And sleep apnea not just makes you feel poorly, you're exhausted all the time, you can fall asleep, behind the wheel of your car, you have very low energy, you can sometimes have headaches and those sorts of things, so you don't feel well when you have it. But also it's related, it's very closely associated with a lot of other medical problems. And we see a lot of those in my field of cardiology. So it's very strongly associated with atrial fibrillation, with high blood pressure, with congestive heart failure, and other types of rhythm problems, including a slow heart rhythm, where you might even need a pacemaker. And so there's lots of other problems that are thought to be directly related to sleep apnea. It's a little hard to say for sure whether sleep apnea is the cause, because there could be a lot of other contributing causes, but it's thought to be at least one of the factors. So that is why there's more of an emphasis in getting it appropriately diagnosed, not just to help people feel better, which I would argue is the most important reason, but the second is that it can help either prevent or treat some of those other just debilitating cardiac problems.
Great, thanks for that. Okay, everybody. Made it another hour and a half, and it was fun. And look forward to seeing you all next week.
Thank you.
Thank you, everyone.
Take care.
Thanks.